Good day everyone, I am Glen Pacada from BSN 3C, and in this video I'll be discussing the cranial nerve assessment. First, assess the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, assess mental status or ability to participate in the procedure. Next, for the planning, if possible, determine whether screening or complete neurological examination is indicated. This impacts the preparation of the client, equipment, and timing. Next, prepare equipments such as percussion hammer, wisp of cotton to assess light touch sensation. Next, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, quinine flavor, percussion, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. Next is for the implementation. For the procedure, introduce self and verify the client's identity, explain to the client what you're going to do, why is it necessary, and how the client can cooperate. Next, perform hand hygiene and observe other appropriate infection control procedure. Next, provide for client privacy. Inquire if the client has any history of the following: presence of pain in head, back, or extremity, as well as an onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of loss of consciousness, fainting, convulsion, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory, or mood swings problem with smell, vision, taste, touch, or hearing. For assessment of cranial nerves, number 1, the olfactory, ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. Next, for the cranial nerve number 2, the optic, ask the client to read Snellen's chart, check visual fields by confrontation. For the cranial nerve number 3, perla, for the pupil reaction, pupil are equal, round, reactive to light, and accommodation. For the cranial nerve number 4 and number 6, trochlear assess 6 ocular movements. For cranial nerve number 5, trigeminal, where the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. To test light sensation, have the client close their eyes and wipe a wisp of cotton over the client's forehead and paranasal sinuses. To test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. For the cranial nerve number 7, for the facial, ask the client to smile, raise the eyebrows, frown, puff of cheeks, and close eyes tightly. Ask the client to identify various tastes placed on the tip and sides of the tongue, sugar, salt, and identify areas of taste. For the cranial nerve number 8, auditory, assess the client's ability to hear the spoken word and the vibration of a tuning fork. For the cranial nerve number 9, glossopharyngeal, apply taste on the posterior tongue for identification. Ask the client to move their tongue from side to side and up and down. For the cranial nerve number 10, the vagus, assess with cranial nerve number 9, assess the client's speech for hoarseness. For the cranial nerve number 11, accessory, ask the client to shrug shoulders against resistance from your hands and turn head to side against resistance from your hand. Repeat for the other side. For the cranial nerve number 12, for the hypoglossal, ask the client to protrude the tongue at the midline, then move it from side to side. And for the evaluation, evaluate the patient's response to the procedure, document the procedure and other important data on the client's chart.